You good now? Okay. No, that's all right. All right, can you guys hear me okay now? All right, sorry about that. Wasn't pushed. All right. All right. So I'm going to repeat myself, of course, since no one was able to hear me the first time. My name is Alex Berchuin. I'm the Director for Advanced Lung and Heart Disease. In the comment section, you can ask any types of questions as far as it relates to pulmonary, lung health, circulation, anything about the body you can mention. We can talk about medications, anything you want on a live stream. Just write in the comment section. I'll be happy to answer any specific questions you may have. Before we get started, of course, I want to go over a little bit on a 6-minute walk test. Okay, so I did a 6-minute walk test with my group, with my patients. There's a number of patients. I think there's about 10 to 15 people, I think, in my 1 o'clock group. And I want to kind of go over the 6-minute walk test. So I relayed, and of course, because of HIPAA regulations, I can't relay personal information about said patient. Okay, so when I go over things like this, I'll mention first name, the actual first name, the last name, first initial. Okay, so I'm not going to mention the last name because I can't mention specific. I can't mention anybody's name specifically. Like first names are fine, last name, first initial is fine, but I can't mention full names because of HIPAA regulations, so I hope you understand. But the people watching should know who I'm talking about. So, on the 6-minute, when we do a 6-minute walk test, the point of a 6-minute walk test is to see how the body works when it's exercising, okay? So we want to see how fast, how far somebody can go before they have to sit down and rest. We want to see how their oxygen does, how their blood pressure works, and subjectively how their pain is, how the work of breathing is, anything like that to give us some good data to understand what the patient's going through. So a lot of these patients that I'm going to mention, I'm not going to mention all of them because it's going to take a lot of time. But let me just mention that a lot of my patients that come to me are not capable of doing a lot at first, and I don't ever expect them to be able to do a lot. So I never exercise anybody aggressively when they start out with us. And remember what we do. We do remote pulmonary rehabilitation. Okay, so we're identical, and we're a certified program. We're covered by all insurances, but we're identical as going into a traditional facility. Okay, that's not me saying that, that's already been proven. Okay, so the results I go over, let's say you went to a pulmonary rehab and the results didn't come close to what you got out of it, then it might have not been a good pulmonary rehab that you went to. Okay, I'm not putting anybody down. I'm not trying to make it seem like we are the cream of the crop, but as far as data goes, we're at 98 percentile. So we are the top level, top end. Okay. Also, as I'm going over some of the data, I don't want to say take it as a grain of salt, but take some of the data that for some people that can't walk more than 20 feet, and then being able to go 189 feet when not being able to walk more than 20 feet, that's a big improvement. Okay, I'm not sure what everyone what they would expect going to a pulmonary rehab program. In a pulmonary rehab program, you should be able to walk further after you finish. You should be able to walk much further, gain your independence, better quality of life, reduction of respiratory symptoms, increase in lung functions, weaning off oxygen if applicable. And what I mean by that is there's sometimes like the heart's very compromised because of the problem. The heart's very compromised, and that person, their lungs might work really well, but their oxygen is so compromised now that it needs supplemental oxygen. We're unable to take somebody off oxygen because of their heart. I went to 7-Eleven this morning, And I always go to 7-Eleven to grab my cup of coffee. But I go to 7-Eleven this morning, grab a cup of coffee, and the cashier, middle-aged lady, cashier, saw that I was a respiratory therapist by looking at my badge. And she asked me a simple question. And it's like, I've been trying to stop smoking, is what she said. I've been trying to stop smoking, and I know I have a lot of time left in my life, and I know I have COPD, but how do you quit smoking? I said, well, let me make sure you'll understand this, is that waiting too long, people don't necessarily die from COPD, they die from complications of COPD. You don't die from COPD itself. You die from lack of oxygen, high CO2 levels. You die from complications of COPD. So it's not like you have a ticking time bomb, that's, one day everything's going to end. I mean, we all will die, of course. That goes without saying. But when somebody approaches me saying, hey, I know I have a lot of time left, and, I'm just trying to find a way to quit smoking, and once I do, my lungs will go back to normal, that's no way correct. That's not correct at all. You're waiting until everything is at its worst point in your life, and for you being so weak because as a result of not being able to move a lot, and you're just waiting and procrastinating and keep waiting and waiting, well, obviously the symptoms will just keep getting worse. The lung tissue becomes more and more dense. So why would you wait? I was trying to explain to this person, which is a very fair person and a very fair question. How do I quit smoking? Very easy. But quitting smoking is just one tactic to improve your lung functions. And it's not going to increase it that much if you don't do anything about it. Us waiting too long will just lead to, all right, I'm end stage now. I'm on supplemental oxygen. I'm on 6 liters of oxygen. I have this problem. I have AFib. I have all these problems. And now you're entering into a program extremely late, which is still beneficial, but you're entering a program so late that you're going to be overwhelmed with the things that you have to do to regain your life back. Okay, I'm not trying to be a Debbie Downer, but you don't wait to the last minute. If somebody's sick, you don't wait until they're near dead before you do something. If somebody has a high temperature and you realize that the temperature keeps increasing, you shouldn't wait until the person passes out. You should do something to help aid the recovery. Okay, so anyways, as I digress. So Gene R. Now, like I said, I can't mention a tremendous amount of information about a said patient, but Gene R. So you're obviously on your 6-minute walk test. You did incredibly well. You did incredibly well. Volumes are definitely climbing. 1,625 is actually not that bad at all. Your overall breathing levels are very good. We still have to wean. So when somebody can only do like 20, 30 feet, now they're doing, 1,200 feet, that's pretty average with us. What did your pulmonary rehab do? If you went to pulmonary rehab, what type of outcomes did you gain from it? Besides the experience, what type of knowledge did you gain from it? These are people that are actual patients, and a lot of them weren't able to do a lot, but as I'm seeing that blood pressures look fantastic, the on non-supplemental oxygen, so a person was weaned off oxygen, I saw an increase in pulmonary functions with Kelly. I'm seeing let me see here, not that one. I'm seeing people, my patients, working out aggressively hard. Remind you, everyone I know there's a lot of people that are my patients that are on Facebook right now watching me. Even though you're going further, you're walking further now, you're starting to see an increase in your pulmonary function test. by going to your pulmonologist to get a test done. And we're going to start weaning off oxygen. Yes, we're going to start seeing a large amounts of patients with increase in pulmonary function test, as well as their 6-minute walk test, as well as the ability to wean off oxygen completely. So we still have that in the works. But what I get a lot is once somebody feels that they're 100%, they want to enjoy their life, and I don't blame them. They've probably been cooped up in their home for such a long time. But we want to make sure it's consistent before we discharge you. So you don't want to try to just, yes, you're feeling great, but you're going to have up days, you're going to have down days sometimes. And what I mean by downhills is like sometimes the pollen is very high in the atmosphere. So let's say there's a wildfire and that's really bad. We're going to have good days, we're going to have bad days, just like any normal life, any person's life, we're going to have that. I mentioned to my patients that we know all too well how to be a patient, but we forget how to be a human being. But these results, I can't be any more prouder of my patients because they're putting their heart and effort into each and every single of their exercises. That being said, I want to congratulate Elizabeth S. She's in Tennessee. And I want to also thank, let me see, who is this? It's hard to read doctors' handwritings here. Okay, I want to thank, let's see, there's Elizabeth, Cedar Hill, Tennessee, Cornell. All right, so big shout out to Vanderbilt University Medical Center for submitting that absolutely Vanderbilt University, so it's a very, very good hospital system, good teaching hospital. So this is a new patient I'll be working with. Let's see, I also want to thank, another one from Vanderbilt. So we want to say thank you to Vanderbilt for all these wonderful referrals that we're getting. We're going to work on your patients very, strategically. And of course, I'm not going to forget Pulmonary Associates of Fredericksburg. We have another Riverside. That's Riverside Pulmonary Associates. I have just a tremendous amount. I mean, just pages and pages of referrals. So I just want to thank these doctors and these facilities for having us help their patients out. We do a lot of self-referrals. So a lot of people that have that want a self-referral in. So if you So my class, I have another spot open that if you want me personally to rehabilitate your lungs, not try, but rehabilitate your lungs. If you want me to rehabilitate your lungs, just understand that you're going to be going through we'll be working out in a different way, but how you're seeing me and I'm seeing you, even though I can't see you right now because we're using Facebook and we're live streaming, but in our Zoom, kind of like FaceTime. Have you ever been through FaceTime before? That's how we work our program out. So I'm looking for 50 more people that want to be that want to work out in our program. And even if you want to try it out, I'm more than happy to show you the ropes and how it all works. I have a question here from Con. I'm suffering from COPD. I'm on oxygen support since 2020. I'm 34 years old. What should I do? What that I will not need oxygen support, O2 support? Please help. Con, I would recommend that, let's see, hold on. In Zoom rehab, can other patients see each other? Patty, no, it's just like if you were in a facility. This is identical. That phrase, that word rather, should really determine. So yes, we're on Zoom. But if you're in a physical program, like you go in a brick and mortar, you work out in a group. And if you didn't work out in a, well, why is it so important to work out in a group? you have other people with the same like diseases that are working out, and they tend to show like peer support. And that's one reason why we like the group. Okay, we like the group supports, so we want people in a group. But again, there are some people that enable their videos so they can be seen by everybody, and there's people that don't want that option. They want to only be seen by me, okay, in the group, so no one else can see them. You have that autonomy if you want it. So yes. But Con, just to answer your question, if you go to our website, homerehabnetwork.com, and there's numbers there, there's emails, whatever you need to do, we get that directly. So if you want to see us, if you want us to help you out, or at least look at your options, we're one of the best options there are, because if we see that you need a physical facility, we'll actually try to get you into a good physical facility that's near your home. If that facility is not available or their outcomes are very horrible, we'll relay that information by looking at the data that they report on their about their program. I don't want to say all, but some programs out there are very, very good, while some programs are out there are not as good. Okay, and as I go over some of the data in our live streams, and we'll be doing this routinely now, as I go over some of the data, if your pulmonary rehab didn't do that to you, then I'm sorry, but you didn't go to a good pulmonary rehab. You probably went with the judgment of your doctor, because your doctor wants you to go to this pulmonary rehab, but maybe your doctor made a mistake. I don't know. Maybe your doctor made a mistake. I have no idea. But if you didn't get the results you wanted, you weren't weaning off oxygen, you're not walking further, you're not stronger with your lungs, your pulmonary function test increase, then I'm sorry, but you didn't go to a good pulmonary rehab. This is what you should be. This is what you should be looking forward to. Looking forward to weaning off oxygen. You should be looking forward. You should be having the chance of weaning off oxygen, increasing lung function, getting your life back, be able to walk at least a mile without stopping. This is our basic standards here. That's why everyone talks very highly about us, because our standards are very, very high. We don't stop. We're covered by insurance, but we don't stop until that person is satisfied with the results, as long as they're like, let's say somebody with end-stage COPD. I'm not going to expect that person to run the Boston Marathon, right? But if I can get that person with end-stage that can't walk more than a few feet, getting them up to a mile, increase in lung functions by 15, 20, 30%, then I've done my job. That person does not need me anymore. That person has their life back. The person's able to walk. Person's able to talk. Person's able to do, everything that, and probably even also reduction in their respiratory medications. That does happen quite a bit, by the way. Let's see. I'm in your 1 o'clock, and we have some nasty weather coming in, possibly tornadoes. This weather, I tell you, is just unbelievable. What are your thoughts? Let me answer first, Karen. So what are your thoughts on getting a lung lavage? Well, it's necessary for different procedures. Okay, necessary. It's needed for some other procedures. It's not necessarily something I do for each and every person, because I don't need to lavage somebody's lungs unless it's absolutely necessary. So when is it necessary to get a lung lavage? And what that means is a lung washout, where we put fluid into the person's lungs, kind of cleaning it out a little bit, But it's not like we take a scrubber or a very small toothbrush and scrub the inside of your lung. We can't do things like that. But lung lavage is a way to get really thick mucus to loosen up. It's a way to clear your lungs. And we do this in a clinical setting. I can't show somebody to do it at home, per se, unless they're on a trach, which we do. These are like a tracheostomies. Like somebody's laying down, and they have, I'm seeing a lot of frothy sputum, maybe really thick sputum, and I'll lavage them. I'll put in, about 3 milliliters of distilled water into their airway, but I'm trained to do that. right? Because I can look at adverse reactions and how to react to those adverse reactions. If somebody else did, they wouldn't know. They probably wouldn't know what to do if something happened. Okay, oxygen starts dropping. You put it in your lavage, the oxygen starts dropping. Somebody starts getting tachycardic. What do you do about it? You know, that's what clinicians are there for. They're there because they're trained on specific things. So I wouldn't say, Karen, that lavage is meant for everybody, but there are some reasons why we use it. There's some, some things that we use lung lavages, or we do lung lavages on certain people, depending on their circumstances, and that's the best way I can answer that. Okay. Now, Michelle Jones, I'm in. You're talking about tornadoes, so yes, you're okay if just take care of yourself if you're in a tornado. You know, the best thing to do with any type of weather is first knowing what to do, right? Your house, the lower end of your house is probably the best. The basement area. To a shelter for a tornado, depending on the severity. You don't know how severe the tornado is going to be, just in case. So yeah, Michelle, no worries. Okay, no worries. Any other questions? All right. So if you're trying to get into trying to get in rehab with me, all I need you to do is fill out a form online. It's you refer yourself, basically. We do contact your doctor. We do make sure that your insurance is approved. This is a medical grade program, of course, and it's a certified program. So yeah, we play things by. Any questions on as far as anything I just went over right now? If you guys have any questions, just write in the comments section. I'll be happy to answer any types of questions you may have. All right, as we're waiting for some more questions, when I did the calculations and everything for the 6-minute walk test, everybody did incredibly well. And what I mean by that is from your first data, which was how far you can walk, what we obtained on your care plan, and now being, your pain is a lot less, your oxygen is weaning off. I'm not mentioning anybody specifically. This is for the whole group. So the whole group did incredibly well. We all went past our minimum. So use qualifying measures to look at minimums. And usually the qualifying measure is 200 feet. If somebody can pass or get close to 200 feet, that's good. But we want to try to get to at least a mile without stopping. So a lot of people's oxygen sats were not that bad on our 6-minute walk test because you were breathing the right way, because I showed you how to breathe with the exercise. Now, let me look at blood pressures really quick, because a lot of people find this sometimes really confusing. The reasons why blood pressures are so important, we need to see the systolic pressures in somebody's baseline blood pressure. So let's say somebody's baseline is 120/70, their blood pressure. And during the 6-minute walk test, their systolic pressure went from 120 to 130. That's a good result. That's something that we should be seeing. If we didn't see a high increase on somebody's blood pressure because supply and demand, then we're going to investigate further and see why. Maybe they're on a special medication. Maybe they're on a certain medication. Maybe they're just having an off day. But all in all, yes, my guys obviously will be graduating. Ways to go. Remember, we have 3 months to rehabilitate you. So, all in all, we do expect an increase in heart rate. But, yeah, when I see 97% on oxygen, I'm seeing blood pressures went up a little bit from 134 up to 150. That will happen sometimes. Baseline's 133/82. Yeah, when I'm seeing, and then I see somebody's 6-minute walk test, they covered over 2,000 steps. 2,000 feet. 2,000 feet is a mile, whether you like it or not. 2,000 steps is a mile. It's 5,280 feet in a mile. So if we walk 2,000 steps and your length is about 2.5 feet, when you're taking one step and another, you measure from one end to the other end of that one stride, it's about 2.5 feet in length. So when somebody's walking, they're not, well, it's like one step is not one step. It's actually, when I take one initial step, that length, that distance is about 2.5 feet. Do you understand? So when somebody walks 2,000 steps, they've actually walked about 5,280 feet. That's why when you have a pedometer and it says, all right, you did 2,000 steps, well, you just completed 1 mile. So there are people that are doing miles in our program, when I know they weren't able to do that before. But we have an increase in our walking distance. We're getting an increase in our lung functions. We're having an increase in a lot of things, but that's what we want. So I'm not sure what your pulmonary rehab did, but I know what we did. And we do this routinely. So, can pulmonary fibrosis be healed through stem cell therapy? I don't know about that, Kisses from YouTube. I don't know if pulmonary fibrosis can be healed through that. We do increase lung functions as in regards to pulmonary fibrosis, like idiopathic pulmonary fibrosis, and we've had an increase in our DLCO, which technically would say, if you look at the LCO, like DLCO, we look at gas transporting past membranes. If we see a high number, then gases are transporting easily. With IPF, or idiopathic pulmonary fibrosis specifically, the DLCO is usually low and it just gets worse, and lower and lower and lower, where there's no gases exchanging anymore, and now the person's, obviously can't bring in much oxygen, can't get rid of a lot of CO2, and the person dies that way, right? So with what we do strengthen that up where the DLCO starts climbing, improving. Something that you could look at, I don't want to say cure, but it fixes that problem, okay? It fixes that problem. We have, like, Reggie had IPF and was seen by five specialists, 5 doctors over at Johns Hopkins, and each of those doctors said there's nothing they can do. He joined our pulmonary rehab program, and we were able to wean him completely off oxygen. He's now able to do 4 or 5 miles, no joke, 4 or 5 miles without stopping. And he said verbatim, there's pretty much nothing else that I can't do. He said he probably won't go back to running track again because he's older, but that's specifically from him. But that's not one patient. This happens all the time. We just looked at Reggie because he went to 5 of these pulmonologists, 5 specialists, and they all said there was nothing they could do. But there was something that we could do, and we did it. And because of that, he has his life back. He doesn't need pulmonary rehab anymore. He's in our maintenance program, but that's just to maintain what he has. That's different. So, can vitamin D3 and zinc? No, Kisses, there's nothing you can eat. There's nothing that can be consumed. I think, and no worries, I'm not, Dana, I don't know how to contact you. If you can contact us, then we can get you to try out the program, just to try it out before you commit. But you have to go onto our website, homerehabnetwork.com, and just go to homerehabnetwork.com. That's all you have to go to, a website, homerehabnetwork.com. And there's information of how to get into the program, how to refer yourself in. It's very simple, but we can't do it for you, unfortunately. You would have to do it for yourself. And that's each and every person that ever goes into our program has to go through that, which is not a lot. You just have to fill out information just like you would going into a doctor's office. But Kisses, I wish there was something that can be consumed that can fix all these problems, but that's not realistic. I'm not sure how to work Zoom. I don't have a computer. I only have a small tablet. Dana, that's okay. You don't have to work Zoom out. We don't expect everyone to know how to do everything. We train you of how to use Zoom. We train, if it's needed, we train you on every aspect of it, so you wouldn't be lost. We guide you on every single thing. So all in all, there's no excuses, right? Because there's no reason why we shouldn't be participating, right? So this program has worked very well with people in their 90s, with nothing being familiar with computers at all, and they were able to go through the program itself with ease. As you see, our Google reviews are 5-star all the way around. We're rated very, very high, so you have to trust in the system that we know what we're doing as far as helping somebody understand of how to use the platform and things like that. So no worries. Replying to the 4th, they will help you just sign up. You won't regret it. Yeah, you won't regret it. There's no one that regrets our program. You know, it's a very, very good. That's why we're on live and you ask the experts. We're very good at what we do. You know, we're clinicians. We're very good at what we do. Marty, 4 years ago, before I joined your program, I was doing 1,200 steps a day, doing 12,000 steps throughout the day. 12,000 steps. That's crazy, Marty. I remember Marty. He was such a good guy. He ran outside so much, but he was you put so much heart into everything you did, Marty. I mean, everyone does, but I'm saying you put so much heart into it, and look what he's gotten out of it. You know, he's doing 12,000 steps now. Do you know how many miles that is? I mean, my goodness, he's doing 12,000 steps. That's. But everybody, this is what you should be expecting in pulmonary rehab. This is what you should be expecting as far as results. You should be getting better, not staying the same or getting worse. And that's what we do. We get people better. We don't keep them the same. So if you're trying to get into a program, just go to homerehabnetwork.com and fill out that form. I will look at that form. I will call you and just see what your problems are and look at what we need to do to get you better, basically. So if a person can't walk stairs, yes. So even if a person can't walk stairs, climb up stairs, can't walk very far, wheelchair bound, bed bound for a long, long period of time, yes, all those people can be rehabilitated. It's not difficult. We do it all the time. But yes. So pulmonary rehab is rehabilitation of the lungs, right? That includes if you can't walk because you're so breathless, we fix the lungs where you can walk better without being so breathless. Right, we manage our work of breathing. We do better on our lung functions. We wean off oxygen. We wean down on some of the medications. But that's what you should be expecting in pulmonary rehabilitation itself. Any other questions? Guys, keep it going. This is great. You're giving me a lot of information here. But yeah, so pulmonary rehab, we do it for 3 months. It's an hour-and-a-half sessions. For 3 days a week. That's our active. If somebody can't do 3 days a week because of work conflict, or we'll work that patient through no matter what. And sometimes with that type of patient that has they have a lot to do. Maybe they're in chemo, maybe they're doing this, they have to do that. We work the program out to better suit their needs as far as time flexibility goes. Okay. So yes, there is no excuse. It's very highly rated. Many, and I mean many doctors around the United States, all in every single state in North America, submit patients to HRN for good reasons. We get this stack of all these people per day. But these doctors know, these facilities and these doctors know how good we are because we always prove our worth to their patients. And they go back to the doctor feeling a lot better. They're very well educated. They know what to look at as far as pulse oximetry goes. They know what to look at. They know a lot. Okay, there is so much that we can talk about this, but they know a lot. They can do a lot. They are able to live their life the way they wanted to live. They want to be able to go shopping. Now they can go shopping. You know, it's a fantastic program nonetheless. Can pulmonary fibrosis lead to lung cancer? No. Pulmonary fibrosis doesn't necessarily lead to lung cancer. You know, it's a different type of disease because it's not cancer. It's fibrosis. But can it lead to it? Well, I can ask Dr. Shaw on that specifically, but as far as everything I've ever read, no, it cannot. But you want to go to good sources when you're trying to get information. You know, like Wikipedia is not a good source. I'm sorry, but it's not. You know, going online, sure, but which sites are you going to obtain information? So going on WebMD, not a good area to go to. You know, it's not a good spot. Not putting anybody down, I'm just saying it's not a good area. It's not a good place to get information from. But kisses, why don't you fill out our referral sheet, and I'm not going to admit you in, but at least I can look at everything and give you for free. I could just give you my point of view of what needs to be done to. But I already know how to work pulmonary fibrosis. That was my toughest subject when I first started pulmonary rehabilitation decades ago. And we've fixed those people up. So there's not a complication with that. You just have to work the program out. Meaning you just have to attend our program and you have to work out with us. But we can fix that problem, but we're not going to say we cure it. We can't say we cure it because that's not what we do. We fix the problem. Is the gas exchange is having a hard time? We fix it. Lungs are becoming more stiff? We fix it. Hyperinflation therapy. You know, there's a lot of ways we can rehabilitate somebody, but the only way we know is if you participate, right? Because then you're going to have a group of clinicians overlooking and seeing your care plans or your problems, looking at what we need to do to get you from point A to point B, right? Or in this fact, point Z, finishing it all out. Any other questions? So if you're trying to get into a pulmonary rehab program, we're looking for 50 people to be on our mind. If you want, if you just put up on here on the comment section that you're interested in being in the pulmonary rehab program, just say I'm interested, and then we'll reach out to you on social media, the best way we know how, just to contact you through social media. And as long as you respond, yeah, we'll get you in, no problem. But we don't just pull people in. We're a certified program. What we do is we look at your problem, seeing if they're actual diagnosis. Like if somebody just gets a little out of breath because they exercise, they might not be a good candidate for pulmonary rehab. They might just need a gym. So we have to look at the clinical levels. So we have to see, do you actually have a lung disease? You know, what type of lung disease do you have? How far can you walk? How how bad your lung functions? You know, we have to look at all aspects. We have to look at all the information to justify whether or not if you can be in a pulmonary rehab program. But pulmonary rehab program, yeah, you're going to get fixed. You're going to get fixed up. Do I do a 6-minute walk with or without oxygen on? When you're prescribed oxygen, you're going to wear it as prescribed on your first 1 or 2 6-minute walk tests. But once we see your lung functions increasing, we'll start testing you off of oxygen during your 6-minute walk test, and then we get a report to your doctor about, hey, your patient that was on oxygen for 6 years, 8 years, we tested them off of oxygen during a 6-minute walk test. They need to be reevaluated for oxygen use because that patient did very well on a 6-minute walk test, and then that doctor, brings that patient, his or her patient into the office, does the 6-minute walk test, checks all the vitals that we checked, and just confirms whether or not the patient did well without oxygen, and that person's off oxygen completely now, permanently. We do this all the time, but if you're prescribed it, you have to wear it as prescribed at first until we see that you don't need it. And we do that routinely. We do that a lot. Because our thing is we want to always increase numbers. Anybody else? So remember, if you're interested in being in the rehab program, just put down in the comment section if you're interested. I know it's an easy way of doing it, but you can do that instead of going online. But we would recommend going online, going onto the Home Rehab Network website. Okay, Alex, thank you. It's not a question about going online. It's just go to our website, homerehabnetwork.com, fill out a referral form. That's all you need. We just need to know who you are. You can even call us. Just call us directly, and we'll set you up right there. But I'd rather you try the program out first, and just like everybody else does, just try the program out and see if you like it. But as far as results go, well, yeah, we'll definitely give you the results you want, but it'll take a little work. How do you become a respiratory therapist? I know an associate's degree is required. So to become a respiratory therapist, a good question. This is by Neff, NEFF1, lower underscore, and then 1. So the question was, how do you become a respiratory therapist? So you have to go to school. The first degree is the associate's, but then you want to get a bachelor's degree as they're getting rid of the associate's degree. So you want to have a bachelor's degree in respiratory care, and then preferably another degree on top of that, earning your master's degree if you can. You can get a PhD in it, but it's an allied health profession, so it doesn't really lead to an MD degree unless you go into become a doctor, like a pulmonologist. But respiratory therapists are the ones who do the work, for those that don't know. So you won't ever see a doctor performing pulmonary rehab to somebody. Okay, they use respiratory therapists. They're the ones who actually do, like I'm a respiratory therapist. I'm the one who actually does the work, right? Not saying doctors don't do work. I'm just saying I'm the one who does the work to help people, right? So, and I'm a respiratory therapist. So you would have to take a grade 8 exam after you're done. You would get your CRT, then you could start your clinicals. You do your CRT, then you get your RRT, which is a registered respiratory therapist. Looks just like that. RRT, and then it's RCP, Respiratory Care Practitioner, and that's your license under the Maryland Board of Physicians if you're in Maryland. And then you start your career. It's a good amount of process. It does take a little bit of time to get through it. I know a lot of respiratory therapists that, they're not actually respiratory therapists, they're students that try to take their exams and didn't realize how tough it was, how tough those exams are. Those exams are very, very tough, especially the clinical simulations can be very tough. So that's how you become a respiratory therapist. You just have to go to a school. There's a lot of good schools. Salisbury, there's Weber State University in Utah, Salisbury. I know Weber State because I went to Weber State University. But there's a lot of good schools that teach respiratory care, but it does take some time. But when I hire a respiratory therapist, I always test them. Because I hire a respiratory therapist in here. A respiratory therapist should not just understand respiratory therapy, but should understand how to promote good healing, good recovery for somebody with COVID, long-term COVID, COPD, interstitial lung diseases. They should be able to reverse that a little bit. Okay. Over here, what we do is we're very we're very picky. If you don't have a good report, documented report about you rehabilitating people on an ongoing basis, and these are the outcomes, couldn't be hired by us, right? Because we only take in very experienced people that aren't specifically for pulmonary rehab, as not one respiratory therapist is equal to another respiratory therapist. You always want to find people with passion, right? That's pretty much it. That's all the time I have for today. If anybody has any questions or anything, please don't hesitate to write in the comment section. For Thursday on our live stream, we're going to talk a little about some people's results and bring up any type of topics that you guys want to relay to us. But other than that, I'll see you guys later. Bye-bye.